Hello everybody and welcome back. This is Dr. Mridula V Amanath. So I'm sure you're actually counting your days. You're going to approach your due date any moment, right? Well, but there is this one question that I want to ask you. Probably you must have seen in movies or you must have heard when a doctor comes out and says that yes, the baby is a healthy baby. Or in some cases the doctor would say, no, we might have to monitor the baby a little more and then probably we'll shift the baby to the ward or to the room. But have you ever wondered on what basis does the doctor make such comments? The baby is healthy or we need to monitor the baby. Is there any particular score that we use to measure? Well, stay tuned because I'm going to talk to you more about this Apgar score. So this Apgar score was invented by an anesthesiologist. So her name was Virginia Apgar. Now she developed this so that there's a uniform way of assessing these newborn babies.
The first assessment takes place at 1 minute after birth and the second occurs 5 minutes after birth. Okay, so basically here we evaluate 5 important points. Now each of the 5 areas receives either 0, 1 or 2 points. Therefore, the total score is always between 0 and 10. Now if the score is higher, then the better the physical condition of the baby.
So generally a score which is above 7 is considered good. And let me tell you, none of the babies, at least majority of the babies, never reach a complete score of 10. So generally if you see, the 1 minute score that we take for most of the kids is a little low. And I wouldn't say it is, very accurate because generally there is a lot of fetal distress, meconium suction and other resuscitation measures that takes place. But the 5 minute score that we take is very accurate and it gives us an idea about the health and the physical condition of the baby.
So we assess the baby's heart rate, breathing, reflexes, muscle tone and color. So the heart rate is considered great or given a score of 2 if it is more than 100 beats per minute. Now the breathing is considered great or given a score of 2 if it is regular, and if it is weak and irregular, then it will be given a score of 1. Now coming to the reflexes. Now if the reflexes such as sneezing, coughing or grimace is there, then they are given a score of 2. Now coming to the muscle tone. Now if there is a slight good flexion of the arms, then again they are given a score of 2. Now coming to the color. Now if the baby is pink, then it's given a score of 2. But if the body is pink, hands and feet, then it's given a score of 1. But if it is blue or pale in color, then it is generally given a score of 0.
So like I said, this Apgar score is a very important score. It becomes a part of the baby's medical record. So now based on this score, we can kind of evaluate the baby's health and the general condition of the baby. And also based on this score, the pediatrician will also have a look at it and would do the necessary resuscitative measures or the baby requires an additional care, then definitely it would be done based on this Apgar score. Okay. So the next time when the doctor makes a comment that baby is healthy or needs a little more care or attention, you know what it is based on and you also know how to evaluate the baby. Okay. So stay tuned and happy. Bye-bye.